I'm Dr. Michael Horn. I'm the breast guy. I do the most breast augmentation in Chicago, and I want to talk to you a little bit about choosing the size of your breast implants because it's so important to get a size that you like and that you're comfortable with. So what we like to do in my office when patients come in for consultations is there's actually two things we like to do. We like to use, first of all, something that we call computer imaging, which is basically a machine that takes photographs of you from different angles. Then the computer can put it all together and make sort of like a little picture of you that's exactly you, with your skin and your bone shape and everything identical to you, and we can kind of move it around and look at it in all different directions. Then what we can do is pick different shapes and styles of implants, put them in there and kind of look at it. It gives you actually a picture of something like what you would look, at least size-wise. Now, my surgery results look better than the computer does it, but at least the computer gives you some idea about what the size might be after surgery. When choosing size, it's nice to pick one that's pretty close to your natural breast base width. That way it doesn't leave a big gap between the breasts. Patients don't like having a big gap between the breasts. So we get one that's sort of pretty close to that width. It makes it so there's not a big gap, but we don't want to kind of go beyond the width of your natural breast. We want your own breast tissue to kind of cover the implant so you can't feel the implant as easily. You don't see any difference between the shape of your natural breast and the shape of the implant. And also so your nipple sits right in the right place so it still looks like a breast. It doesn't look goofy. And so those are sort of things that we use to kind of narrow down which sizes we know will look good on you. The other thing we like to do is have patients try the implants on in an actual bra in the office. If you come in the office, we'll have you put on a bra that's about the size that you want to be, put the implants in the bra, look in the mirror. Nothing better than that because it's your height, your frame size, pretty much what you see is what you get. Although when you put in the bra, maybe after surgery it looks a tiny bit smaller, but very, very little difference. So that's, by doing those things, I think patients are really comfortable size-wise. And the nice thing I think about the computer imaging is that you see how little difference there is between two sizes. There's so many sizes of breast implants. Unlike clothes that go size 2, size 4, the implants would be if there was like a clothes size that went size 2, size 2.2, size 2.4, that kind of thing. So there's very, very subtle changes in size that we can use, and that's also useful because if one breast is a little bit larger than the other, we can even that out in surgery and make your breast more symmetric by doing that. So I find patients are much more comfortable after viewing the Vectra and trying them on, and that way patients are real comfortable with surgery. It used to be patients would, kind of call me up the night before surgery and say, am I sure I'm choosing the right size? Maybe we should go bigger. But really, I think by doing those things, you really can feel real comfortable that the size you're picking is a good size for you and one that you want. The other thing is patients frequently ask, well, what bra size is this going to be? Well, I think the best way to predict what bra size your implant is going to be is actually put on a bra that's about that is the size that you want it to be. Put the implant in the bra with your natural breast and see how it fits in there, because pretty much the way it fits in the bra in the office before surgery is the way it's going to fit in the bra after surgery. Because to get your bra size, really, you have to add your own breast tissue to the implant to get the total volume that fills the bra. So the same implant may be a different bra size in one woman as it would be in another. Also, when it comes to bra sizes, it depends on what bra brand you wear, because, for example, Victoria's Secret, they tend to, for a smaller breast, would be sort of a larger cup size. Sort of the same breast may be a B breast in a different brand. In Victoria's Secret, it might be a C. Also, there's sister bra sizes. That is to say that if you get a different number of inches around, it can change the cup size and still fit the same person. So, for example, if you got a 34C, that would be the same as a 36B bra. So really, I think the best way to see what bra size it will be is basically just kind of put on a bra in the office, put the implant in the bra, and see which one's filling it. If it's too big for the bra, it's going to kind of bulge out of the bra up this way, or push this middle part of the bra up away from your body. That middle part of the bra should be kind of right up against your body if the bra is fitting right for the implant. Of course, if the implant's too small for the bra, you're going to have a whole bunch of extra space in the bra and that sort of thing.